Hello, doctors. So today I'm going to talk about the angry patient. These type of stations are also fairly common in the exam, and the basic idea behind these stations, the core of these stations is basically dealing with an unhappy customer. Okay. So in these stations, you have a patient who is angry about something and he wants to complain, and he's really angry, sometimes maybe even shouting. He can be angry about something that is wrong with his treatment, which he thinks that is wrong with his treatment, or some complication that he has developed as a result of the treatment. Or he might be complaining about the behavior of some of your colleagues, like other doctors or nurses. Okay. But the basic idea here is you need to tackle his anger, and you need to do not need to be reactive. You do not need to get angry yourself. You need to be calm and tackle his anger and provide him solutions. Okay, so first of all, I'm going to discuss the basic steps in the angry patient approach, and then I'm going to also explain them with the help of an example. Okay, so we have six basic steps here. The first step is introduction and paraphrasing. Like every other pleb 2 station, you need to introduce yourself and paraphrase your task. Okay, but sometimes the patient is so angry that he wouldn't even let you introduce yourself. He starts talking as soon as you enter the cubicle. Okay, as soon as you enter, he looks at you. He starts talking, and he's saying that I developed this complication. I don't think my treatment is going in the right way. Are you people are ignoring me? Are you people are not taking me seriously? So he's really angry. Okay, what to do in that scenario? In that scenario, you need to tell him that I can see that you are upset, but is it okay that I confirm a few details before we start? By the way, I'm Dr. Aisha. So you need to introduce yourself like this, because introduction before you talk to the patient in the exam and in the NHS also, you need to introduce yourself. That is a must. Okay, so you need to introduce yourself like this when the patient starts first. That I can see that you are upset, but is it okay if I confirm a few details before we start? By the way, I'm Dr. Aisha. Okay, so you introduce yourself like this. Of the patient in these in the angry patient stations, the patient talks a lot. Okay, he's angry and he's venting out. And please don't interrupt the patient, let him talk. But also when he's talking, you need to note. You need to note a lot to show that you are actually listening to him. Okay, how would the examiner know that you are listening? You need to note. Okay, the examiner would be looking at your neck, so note a lot in these stations. And then the third step is acknowledging and apologizing. So you need to tell that I can totally see why you are upset, and I'm really sorry for what has happened. Okay, I can totally see why you are upset, and I'm really sorry for what has happened to you. Okay, then the fourth step is taking history with signposting. Okay, so by signposting, I mean that tell him that is it okay if I ask you a few questions in order to understand better and explain you a situation better to you. Okay, after taking history, you would come to know, you would be able to pinpoint the problem. You would be able to know why this complication has happened. You would be able to know if there is something wrong with the treatment or not. Okay, you would be able to know about the colleague, about the behavior that he's complaining of, so you would be able to pinpoint the problem. So the fifth step is explaining why this has happened. If a complication has happened, then you need to explain why this has happened. Okay, so the sixth step is basically providing with solutions. All right, now I will explain this with the help of an example, and it would be you would be able to understand better. Okay, so the first scenario here is basically post-operative infection. So if you look in the Aspire notes, because Aspire notes are the one that I followed for my exam. Actually, I didn't follow the notes. I just used the notes for the scenario. The scenario there are really good, but the notes themselves are not good. They're basically copy-paste from the NHS website. All right. So the first scenario there is post-operative infection. Okay, so now post-operative infection can present as infection of different site. Either there will be abdominal surgery or some sort of knee surgery or any sort of surgery which the patient has undergone, and now he has developed an infection and he has come again for follow-up and he's really angry about it. Okay. So the first step here is that you introduce yourself and you paraphrase that Mr. Smith, I can see from your notes that you undergone a surgery about 3 weeks ago. Am I right? And now you have developed some pain and swelling in the one side. Can you please tell me a bit more about it? Okay. Then the patient will start talking and he will be venting out and he will be showing his frustration. So you need to listen to him. You don't need to interrupt. Let him talk. Even if he talks for a good 3 to 4 minutes, don't interrupt. All right. And then in the third step, you need to acknowledge and you need to apologize. You need to say that I can see that Mr. Smith, you are really upset. And anyone in your situation would feel this way. And I'm sorry for what has happened to you. Okay. So the fourth step is basically history with signposting. So tell him that, is it okay if I ask you a few questions before we discuss further? He would be saying yes. All right. So you need to ask him, how did you find out that you have an infection? Was there any pus, any bleeding, any pain, any swelling, any fever? Okay, the cardinal symptoms of infection. Then you need to ask, what did you do after? Okay. So how did you find that you have an infection and then signs of infection and what did you do after? All right. Did he take any medication? Did he change his dressing? What did he do after he found out that he has infection? Then you need to find about the risk factors for infection because not every patient who undergoes a surgery ends up developing an infection. Okay, so you need to find out the risk factor for this infection. So ask him before, during, and after surgery. Ask him before surgery, did anybody tell you about the possibility of infection? Okay, so he might say yes, because this is a basic protocol of surgery. In the preoperative assessment, we tell the patient about all the possible complications, even if they are rare. Okay, so ask him before surgery, did anybody tell you about the possibility of infection? During surgery, did you develop any complication? After surgery, did they explain to you about the dressing? Okay. After surgery, did they explain to you about the dressing? And also ask how do you do it, whether he's following their advice or not. Okay. Then any medical problem that might contribute to the infection. So ask him about, do you have any other medical problem at all? Do you have any um, disease like diabetes or high blood pressure? Okay. Are you on any long-term medications? And do you smoke? Because smoking also contributes to the infection. All right. Then you need to explain why he has developed this infection. Okay, so if the patient, in case the patient doesn't have any other medical problem, he's not on any medication, he's not smoking, and he's following the advice of the doctors about dressing, and he did not develop any complication in surgery. So you are not actually able to tell where the problem has occurred. So in that case, you will say, I'm sorry, I'm not really sure at the moment what has caused your infection, but I can take a look into your notes to see if there is something wrong in your treatment. That's okay with you. Okay, sometime after taking all the necessary care, patients still get infected. Okay, but if you are able to pinpoint the problem, you are able to pinpoint a risk factor, then you need to explain it to him that this is the risk factor which is contributed to your development of infection. All right. Then you need to tell him about the medical management of the infection. So tell him that I'm a bit concerned about your infection, so I'm going to take a sample from the wound and I'm going to send it to the laboratory to see that which bug is causing the infection. I'm going to clean the wound and do the dressing, and I'm going to start you on antibiotics according to the hospital protocol. Okay, so take sample from the wound, clean the wound, do dressing, and start the patient on antibiotics according to the hospital protocol. All right. Now, patient advisory liaison unit, only if patients really wants. What do I mean by that? So by this, I mean that you do not need to tell the patient by yourself that, you can complain. Okay. Because here, this is not your fault that the patient has developed infection. Okay. The patient has developed infection because infection is a common post-operative complication. Okay? And sometimes, as we told the patient as well, that sometimes after taking all the precaution, patients still get infected. So this is not actually your fault. So only if the patient really wants to complain, then you tell him about pulse. In the medical error stations, I told you that it is your duty of condover to tell the patient about pulse because you have committed the mistake, and this is your duty that you need to tell the patient that there is a department where he can file a complaint. Then this is the patient discretion whether he wants to file a complaint or not. Okay, so in that case, this is your duty, but in the angry patient, you only need to tell if the patient really wants to know, otherwise, you don't. I hope I'm clear. So this was the angry patient approach, and I will see you soon with another video.